This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Well, welcome everybody. Thank you for coming out and listening. My name is Dr. Tram. I'm the APD at Loma Linda University's PM&R program. It'll be a pretty informal presentation, probably maybe like 5-10 minutes-ish, just giving you a brief overview of what our program has to offer, and then we'll just open up the floor to you guys to see if you have any questions. I'm joined here by Dr. Whitwer, our current chief resident.
Hi, everyone.
Let me just figure out how to share this. Sorry, I've been having some technological difficulties all morning, so if there's any issues, just let me know, please. All right, well, like I said, Loma Linda University. So this is just a picture of our, actually our old building. We have a new hospital, but I don't have a picture of that one yet. So where is Loma Linda? So if you guys aren't familiar with California or Southern California, Loma Linda is right here in this area, kind of somewhere in between LA over here and San Diego down here. So lots of different names and things here, but more importantly, better map. So Loma Linda right here. Up here you have Big Bear Lake where lots of people go skiing, hiking. Over here you have Palm Springs. I know there's a TV show about it now. Coachella Valley is right over here. And then of course here we have Disneyland and Los Angeles, Santa Monica. You can go surfing over here. So more important schematic of all the fun things there is to do around Loma Linda. So one interesting thing about Loma Linda is it's actually been talked about in a National Geographic article regarding the blue zone and about secrets of living a long life. So in this article, they identified 5 different cities across the country where people lived longer than average. And of those cities, Loma Linda, California was one of them. And in the article, granted it was from November 2005, but it did say that typically the age population of Loma Linda is around 10 years longer than the average in the US. So interesting things about Loma Linda. So the motto of Loma Linda is to further the teaching and healing ministry of Jesus Christ, and more importantly, to make man whole. And to do that, we look at clinical care, education, research, and wholeness. But what about the residency program? So here you have a picture of our inpatient rehabilitation center, and then these are just some of the things that we have in our gym. Our aim as a residency program is to educate and equip physicians in PM&R to foster compassionate, growth-minded physicians, lifelong learners, and to promote excellent whole person care. So the positions that we have available, so we're both the combined categorical and advanced program. We have 4 categorical residents per year, so they start as a PGY1 through PGY4, and then we have 1 advanced position. So there's an advanced resident who joins us as a PGY2 for a total of 5 residents per year for the actual PM&R portion of the training. We have different training sites. So our main one is Loma Linda University Health System, but we mostly divide our time between there and the VA at Loma Linda. We do have a couple of months over at Kaiser in Fontana. I'm probably about 15 minutes away. And then if you are with us as a categorical, we do a rotation at a county hospital, maybe about 20-30 minutes away, depending on the traffic. So overview of rotations. So the rotations do occasionally change, but in general, this is what you'll get. So internal medicine, lots of exposure to internal medicine if you're joining us as a categorical in your PGY 1 year. So you have medicine wards, ICU, CCU, so probably around 5 to 6 or so months of this. So you'll be very well prepared for just the medical issues in general going forward. And then we also have some subspecialties, so infectious disease, neurology, rheumatology, nephrology. One thing that I do like is during your PGY1 rotation, even though you're an intern and you mostly work with our internal medicine colleagues, you do have a built-in PM&R rotation just to get your feet wet and get you ready for the transition into PGY2. And then there is some elective time built in as well. For your PGY2 year, this is when you start your actual physical medicine and rehabilitation training. And so we have, it's our PGY2 year, I would say, is more heavily inpatient. So you do have your inpatient rehabilitation, which is divided into your stroke rehabilitation, your traumatic brain injury rehabilitation, and then your VA inpatient rehabilitation. And so that will vary with orthopedic cases, amputation cases, and just general PM&R bread and butter cases. You also do some outpatient rehabilitation, the majority at the VA, so lots of focus on musculoskeletal conditions, ultrasound, pain, some EMG exposure. And then you do have a Loma Linda outpatient rotation where you kind of have a whole gamut of everything, as well as your pediatrics rotation. Some of you will get your elective in your PGY2 year, others will get it in PGY3. For PGY3, you spend a couple of months doing spinal cord injury rehabilitation on the inpatient side, and then you continue your outpatient rehabilitation series with added bracing, amputation, pain. And then for 5 months, actually, you have a very immersive EMG neuromuscular program to get you used to doing all the EMGs, because one of our requirements, or actually it's not just our requirements, is around 200 EMGs or so. And so we definitely meet those numbers with our rotation. And we actually end up doing more EMG than most of our neurology colleagues. And then finally, your 4th year, you finish off your inpatient rehabilitation series as a senior acting as a junior attending on at the VA supervising your PGY2 colleagues. And then you, again, still have your outpatient rehabilitation series at the VA and Loma Linda, but this time you'll actually have exposure to the Kaiser system as well. And that's a great rotation where you can kind of practice your independence. Followed by pain, pediatric, and elective. Pain actually will be kind of spread out throughout your outpatient months. And then we have our didactic teaching program. So we have our rehabilitation series, which focuses on kind of bread and butter PM&R, stroke, brain injury, neuromuscular, prosthetics and orthotics, spinal cord injury, pediatrics, pain, rheumatology. We have a grand round series. This year, we're trying to change it up to incorporate more of our multidisciplinary groups as well. And so it's going to be a multidisciplinary grand round series that incorporates our nursing, our physical therapists, occupational speech therapists, neuropsych, just so we can make it more collegial as well as to see what updates are going on in their fields. We have our EBM and Journal Club series, our morbidity and mortality series, as well as quality improvement and whole person care. And then we also have our separate musculoskeletal series, which focuses on anatomy, physical exam, radiology, therapeutics, ultrasound of different body parts. One thing that we also include in here is clinical cases where we do practice oral boards cases. And then we also have our resident wellness and neuromuscular and EMG seminars. As all programs, we do have a lot of interest in research and scholarly activity. And so all residents are required to participate in scholarly activity. And so they'll have research guidance and support from our department's research advisor, as well as quarterly research labs to kind of check in, make sure everybody's on track with everything. And at the end of every year, there's an oral presentation during which the PGY4s present their projects for the duration of their rotation. I don't have it in here, but our goal is to have every resident present at a national conference at least once during their residency. So one question that we get a lot from other people is, so what makes you guys unique? So things that have been brought up by our current residents and other people who have rotated through is our formal whole person care curriculum. As somebody going into PM&R, there's a lot of focus on holistic care and focusing on the patient as a whole, which I think most PM&R people do in general, but we do have a formal rotation where we work with actually some of our other family medicine colleagues and other colleagues to implement that as well. We have a very, a little biased now, I guess, but a very supportive faculty, mentors, staff at co-residence.
I'll second that.
Thank you, Noelle. We do have a wellness committee focusing on resident well-being. A lot of people are interested in fellowship. We do have an in-house pain fellowship program, which is nice. And then we have directed musculoskeletal and core physiatry didactics. We have a lot of ultrasound exposure. And then, of course, location, because Southern California, you're about 1 hour from the mountains, the beach. You can go skiing and surfing on the same day. And for those of you who like other things, you can also go to Vegas. That's about 3 hours away or so. I know some people have wondered about kind of adaptive sports. And so we do have a possibilities program as well, where they work with our amputation, our spinal cord, or stroke patients to provide them the resources. And they do have some adaptive sports opportunities. Every year they have a adaptive sports triathlon, or a mini triathlon, actually. That's very interesting. And this is our current class for the year. Any questions about anything? All right. Sorry if I spoke quickly, but wanted to give you guys some time to ask any questions that you might have to either myself or Dr. Whitworth.
I see some in the chat that have popped up. The first one I see is, what does the inpatient rehabilitation look like? Is it a separate acute rehab facility or a floor at the acute care hospital? So our inpatient rehab hospital is considered as a separate hospital technically, but it's also adjoined to our East Campus hospital that takes inpatients, and we're able to consult specialty services and order imaging without having to discharge them to the emergency department. And so it is a separate hospital, but very closely tied to the main Loma Linda hospital. So easy to get quick evaluations.
Yeah, so right? Kind of like, no worries. Yeah, so like Noelle said, yes and no. It's not attached to our main hospital, but it is attached to a hospital with an active OR and ICU and everything, as well as wards for. Are there any opportunities for moonlighting? Yeah, so we've had residents who've moonlighted before. Right now, we're limiting moonlighting to your PGY3 year and up, so PGY3 and 4 year. And so it's very depending on kind of your skill set. We've had patients or residents who've moonlighted at urgent care and others who have moonlighted at our surgical hospital. When is our open house? We don't have a current set open house or anything right now. Typically, what we'll do for that, since we're doing virtual interviews this year, is after you have your interviews, we'll actually have a meet and greet afterwards for any of you who want to attend. Usually sometime in February.
Our call schedule. So we take currently home call, meaning when you're on call, if it's during the weekdays, you're taking call from home, you would get pages or chats on Epic. We use Epic, and you would answer if there's an emergency or a patient needs evaluated, you would drive into the hospital, but otherwise you're able to sleep at home. And we break our calls up into weekday calls where you cover Monday night to Thursday night, and then weekend calls where you would round on the inpatients and be on call for the weekend. And typically, I would say we have an average of maybe 4 weekday calls and 4 weekend calls throughout the year when we divide them among the residents. And then I think the next question is, do you offer rotations to visiting IMGs? Dr. Tran, do you know?
I don't think right now for IMGs, unfortunately. Yeah, as far as I know, nothing specific for that, but I can double check with our program coordinator who kind of helps to set up those rotations.
For inpatient rehab, is there IM coverage of the patients, or is it all PM&R management? So at our inpatient rehab, we are primary. So we do medical management of their medical conditions, their chronic conditions. We have an ICU, like Dr. Tran mentioned, and a rapid team, and basically in-house at the adjoining hospital, which we call our East Campus Hospital. So they will respond to rapids, but day-to-day medical management we handle. And then next question is your program open to non-Christian medical graduates, since the mission statement of the institution is Christ-based, or are Christian followers preferred? I would say definitely open to non-Christian medical graduates. I think kind of the overarching mission of whole person care is broad enough. You know, not all of our patients are Christian, and it's kind of looking at the person as being within a community, within a belief system, having values, whatever they may be, whether religious or otherwise, and being able to address all parts of the patient's care. Would you agree, Dr. Tran, or have anything to add to that?
Yeah, definitely. So I don't know the exact numbers, but I know not all of our residents, not all of our faculty are Christian, and so yeah, we're open to everybody.
I'll read you the next one, Dr. Tran. What criteria do you look for in your applicant? USMLE score, graduation date from medical school, accepting IMG or not?
We don't have, I wouldn't say we have a hard USMLE score cutoff. It might have kind of like a ballpark on our FRIDA page. Graduation date from medical school, usually if you're graduating this year, we've had people who graduated the year before and apply as well, and so that hasn't been a problem. As far as I know, I don't believe we've had any IMG residents before.
2-minute warning.
Thank you.
Thank you. All right, so what are the opportunities for sports coverage? Currently, I don't know of many of our residents actively doing sports coverage. I know some of the residents of the family medicine program have done local sports coverage, but none of our current residents are actively doing that. There is opportunities locally, and of course, we're nearby Los Angeles, which has a ton of sports opportunities, but that might be something that you would need to kind of take a self-directed approach to, I would say.
So we don't have any formal sports rotations or anything set up. We do have sports orthopedics here who, if you're interested in sports, you could definitely rotate with on your elective. And we have a couple attendings who are interested in sports, and so they do some sports coverage. It's not built into our curriculum, but we have had residents go with them to do sideline medicine.
And I will add to that, I feel like our program has a very strong MSK training aspect, and even without a formal sports rotation necessarily, you'll graduate feeling very confident in your MSK management, including MSK procedures.
All righty, any last questions? If not, we'll go ahead and switch to our next group. Thank you, Dr. Tran and Dr. Whitwer.
Absolutely.
Thank you so much. If you guys have any other questions, feel free to reach out.